More than 4 years after Oregon voters approved Measure 110, a new state audit says that officials still cannot tell whether the landmark drug decriminalization law is actually working or what exactly it accomplished, despite spending roughly $800 million in taxpayer money.
Fox 12 investigative reporter Ezra Kaplan has been looking over the new report and spoke with the key players.
The audit from the Secretary of State's office finds the Oregon Health Authority lacks the basic data needed to determine whether Measure 110 has reduced overdoses, expanded access to treatment, or improved outcomes for people struggling with addiction. Auditors point to poor coordination, inconsistent reporting, and major data gaps, many of the same problems flagged in earlier reviews. Since 2020, nearly $800 million has been spent on treatment, recovery, and harm reduction services. But the Secretary of State, Tobias Reed, says the state still cannot measure the program's impact.
We need better data, we need more consistency, we need longer-term planning. That's what's going to give this program the chance to work.
Measure 110 was designed to shift Oregon's response to drug use away from criminal penalties and toward public health solutions. But auditors repeatedly conclude that they cannot determine with available data whether the law is meeting its goals.
I think we got to know where we've been if we have a chance at figuring out where we want to go and if we're making progress.
The Oregon Health Authority says it cannot provide baseline data because too many variables changed between 2019 and 2023, making it impossible for reliable comparisons.
There is not a body of data that could serve at a baseline to help compare and contrast where we were before Measure 110 and where we are today, about 5 years later. So there was something called the COVID-19 global pandemic, and that absolutely changed the landscape for basically the entire world in every discipline, but particularly what was happening in the behavioral health system.
The audit does note some improvements since 2023, including increased staffing and more standardized grant processes. But auditors say most of those are administrative fixes and that deeper systemic problems remain. The report reads, the state's efforts address only the symptoms of substance use disorder without effectively treating the underlying disorder itself. Reed also warned that frequent leadership changes and repeated legislative revisions, like recriminalizing possession of small amounts of drugs, have made long-term planning difficult.
We cannot expect to keep changing direction and then to get anywhere.
Auditors issued 6 new recommendations to OHA to stabilize the program. The agency agreed to 3.
So my hope is that we have less change moving forward and it can really stick to what our goals are and what our vision is and make progress in that regard.
This is the final legislatively required audit of Measure 110, though the Secretary of State's office says it will continue monitoring the program. For now, the audit leaves the central question unanswered, whether Oregon's experiment in treating drug use as a public health issue is delivering results. Reporting in studio, Ezra Kaplan, Fox 12 Oregon.